Hi, I'm Dr. Ryan Lange. I own a practice here in Irvine, California by the name of Macarthur Dental Arts. I've been placing implants for about 8 years now. And for this case in particular, I'm going to be using the UPIK solution. I'm doing a crustal sinus approach. And with the UPIK solution kit, they also develop a custom healing abutment based off of where the implant is going to be placed at time of surgery. So with the UPIK solution, you have a very detailed drilling protocol. When you see the kit, everything is labeled and numbered, and it translates to the drilling protocol that they send you, and they tell you very specifically in what order to use each of the drills. You start out by using the guide. You can choose whether or not to use a tissue punch or to do a flap. For this case, I opened a full thickness flap to get a clear view of what I was doing. And then you move up to the osteotomy burrs, which will take you to the floor of the sinus. The drills fit precisely into the guide, and built-in stoppers prevent over-drilling by stopping automatically at the correct depth. This is one of the biggest improvements compared to other kits I've used. With UPIK, you don't need to switch out keys or match different depths and cuff heights. It's a universal system. As long as you follow the protocol, you can place virtually any implant size with the same kit. Once the floor of the sinus has been perforated, there's a syringe that you use with a very detailed amount of saline solution that you want to inject into the sinus cavity. In this case, it's 0.4 to 0.8 cc's of saline. You use the syringe to get hydraulic pressure and lift the floor of the membrane. Once you get that feedback, you can proceed to the next drilling sequence and place your bone graft into the sinus cavity. They have very specific pluggers that you can use to push the bone graft and elevate the sinus. After the bone graft is placed, then you can continue with the osteotomy sequence. These burrs have blunted ends as to not perforate the sinus cavity or the membrane. And you can take your osteotomy up to the diameter that you feel the most comfortable based off of.
Kind of looks like that's your final drill before you place.
I'm not gonna use the healing abutment.
Alright, I have a filter in my hand.
After preparing the bone, I place the implant. The drills have built-in timing marks, so placement aligns with the custom healing abutment included in the kit. The instructions are very detailed, telling you exactly where to stop. Once in position, you will place the healing abutment, suture, and allow to heal. Overall, I would describe the UPIK solution as user-friendly, precise, and highly detailed in its protocol. It gives the doctor more confidence when performing the procedure. It's convenient, eliminates the guesswork, and makes implant placement very straightforward. The main difference with the UPIK system is that it's pre-planned with the URIS digital team to design the entire case before the patient's in the chair. This enables the doctor to have confidence with clear guidance throughout the process. I would recommend this kit to colleagues, especially those new to implants. Everything is packaged in a clear, easy to understand system. Even with limited implant experience, you can feel confident placing implants with this kit.